Good evening, ladies and gentlemen. We thank you once again for joining us for this COVID-19 update. I'd like to acknowledge the presence of the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Permanent Secretary in the Ministry of Education, Human Resource Planning, Vocational Training and National Excellence, Chandler Hyacinth, National Epidemiologist, Dr. Shaluddin Ahmed, Officer in Charge in the Office of the Director of Primary Healthcare Services, Dr. Gilda Nesty Tong, the CEO of the Dominica Air and Seaports Authority, Benoit Badwell, and the Acting Deputy Chief of Police, Superintendent Davidson Valerie. This evening, the cross-section of presenters is testament to the collaborative effort that it takes to continue to keep our country safe. And we'll begin our press briefing with a statistical analysis by the national epidemiologist, Dr. Shaluddin Ahmed.
Permanent Secretary, Ministry of Education, Human Resource Planning, Vocational Training and National Excellence, Mrs. Chandler Hyacinth, Chief Executive Officer, Dominica Air and Seaport Authority, Mr. Benoit Badwell, Officer in Charge in the Office of the Director of Primary Health Care Services, Dr. Gilda Nesty Tong, Deputy Chief of Police Acting, Superintendent Davidson Valerie, Miss Sheena Harry, Communication Officer, Media and Listener. Good evening. We have now 2 new cases of COVID-19. That brings total number of confirmed cases of COVID to 24. These cases are imported cases and not contacts of previous cases. One is 59-year-old female and the other one is 35-year-old male. These individuals have been in isolation since arrived in Dominica on September 5th as a result of positive rapid test on arrival. Subsequently, PCR testing was done to confirm. Currently, they are asymptomatic and admitted to the COVID facility. Contact tracing is ongoing. So far, 6 direct contacts have been identified from these 2 individuals. These contacts are being isolated and will be swabbed tomorrow. Additionally, 14 contacts of the case number 4 are now negative on PCR testing. So to summarize, now we have total number of confirmed COVID cases 24. Our active cases COVID now 6, and number of contacts that been traced and identified were 64, 10 still pending. In terms of all 57 of them contacts are negative of these recent 6 cases. So with this, I want to thank all the doctors and nurses and other staff members at the airport, primary care, quarantine facility, COVID center, and at the Health Information Unit for their support in surveillance during this COVID-19 pandemic. Thank you for your attention.
And we'd like to say a special thank you to Dr. Ahmed. I don't think we thank you enough, Dr. Ahmed, for your tireless work, you and your team. And we also want to say a special thank you to the contact tracing team. We know that this is a difficult task that you have at hand, but you continue to do it diligently, so we appreciate all of your efforts. One of the groups of people very affected right now are students. Most of them have returned to school, some later on this week. And that's why with us this evening, we have the Permanent Secretary at the Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence, Chandler Hyacinth.
Minister of Health, Wellness, New Health Investments, Honorable Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, National Epidemiologist, Dr. Shalodin Ahmed, Officer in Charge in the Office of the Director of Primary Health Care Services, Dr. Gilda Nesty Tong, CEO of the Dominica and Seaports Authority, Mr. Benoit Badwil, and Acting Deputy Chief of Police, Superintendent Davidson Valerie. It's indeed a pleasure to be here this evening as we share with the public on the guidelines that the Ministry of Education will be implementing for the reopening of schools. The COVID-19 pandemic has significantly impacted on the education system in Dominica. There was significant disruption of the regular functioning and education of our educational institutions, as well as of learning of our students and the ability of our teachers and schools to deliver effective teaching. As a result, a plan utilizing appropriate guidelines and protocols for the reopening of schools and other learning institutions within the ambit of the Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence has been developed, and this will serve as a tool for the effective and efficient reopening and continuation of schooling. Schools and other educational institutions are advised to utilize these guidelines, inclusive of other protocols for reopening. Today is day 2 of our opening. We expect that once we have circulated these guidelines, all stakeholders are expected to support the implementation of these guidelines within their schools and under the terms of the existing management and supervision frameworks within the Ministry of Education. And we are doing this in conjunction with the Ministry of Health, Wellness, and New Health Investments and other relevant authorities. And as we are moving along, we expect that there will be continuous assessments and reporting on the adherence of these guidelines. The guidelines have been developed mainly in the areas of hygiene, the hygiene measures that will be taken to include hand washing, respiratory etiquette, cleaning procedures for facilities, and safe food preparation practices. All, as I said already, all educational institutions are to implement these guidelines. The key objectives here are to educate, engage, and empower persons so that we can get a change in their behavior. And the main aim of these guidelines are preventing and controlling the spread of COVID-19. These guidelines are specific to education. And the core recommendations are in the area of health and safety. The protocols are considered in 4 categories. protocols before the opening of schools, protocols during school hours, protocols to be observed after school, and individual protocols. The protocols are categorized and based on the school public, for students, for teaching staff and principals, for auxiliary staff, that is cleaners, caretakers, security personnel, parents and guardians, and visitors to learning institutions. And the basic measures are physical distancing, hand washing, the wearing of masks, and staying home if one has any acute respiratory infection. Given the above, we recognize the fundamental role of individual responsibility, whether as parent, as student, as principal, teacher, or any officer of the Ministry of Education. So significant effort was made to prepare schools for receiving students from day one, which was yesterday. Schools were provided with cleaning supplies. They are being supplied with sanitation wardens, cleaners, and this process is ongoing. We have also assisted schools through training for staff, especially on the implementation of physical distancing, training on school hygiene practices. We have conducted training for auxiliary workers with the Ministry of Health, Wellness, and New Health Investment, all in an effort to implement the rules and protocols related to cleaning and sanitizing of the classroom. As I said already, emphasis is on health and safety. Some of the core recommendations include protocols during school hours. We expect that students on their way to school must wear a mask. Whether you're walking to school, you're taking a public transportation, buses, students must wear a mask. And we are encouraging parents to provide masks for their children or their wards. On entering the school gates, there will be someone to sanitize their hands. Then they will follow the direction of the staff. In small schools, we are encouraging a general assembly because in many schools, there is sufficient space for physical distancing to happen. In some cases where the school population is too big for general assembly, students will be ushered straight to their classrooms where they will be sanitized again and prepared for their lessons. In general assemblies, we expect that whether it is teachers or principal, they will continue to inform students of the behavior change and they will inform them of what is expected of them. Frequent cleaning and disinfection activities will continue. We are encouraging students to use the waste management, follow waste management practices at the school. When disposing of disposable masks, do not dispose of them anywhere. Use the bins provided around the school. We are emphasizing frequent hand washing. And we are encouraging classes, we are encouraging teachers to provide time within the day, time within periods to allow for students to wash their hands. Even if we have hand sanitizers, hand washing is encouraged. And we are in the process of installing facilities for hand washing where limited numbers exist at the schools. We are also encouraging that posters be displayed on the behaviors expected at school. We have produced some 5,000 posters on hand washing, posters on how to wear your mask, different types of posters, and we expect that all of these will be displayed all around the school. We are also expecting that all manipulatives should be sanitized before use and after use, and during use too as well. Manipulatives, especially for the early childhood sector, we are expecting them to play with toys and other manipulatives that are available in the early childhood sector, in the early childhood facilities, in daycares. They should be frequently sanitized. Teachers preparing posters, those should be frequently sanitized. If you are preparing charts, we encourage those to be laminated so that they can be frequently sanitized. We are encouraging our schools to encourage physical distancing in the classroom. So before opening, schools were busily arranging desks so that there is sufficient space between desks so that and we expect that one child to be sitting at a desk, not 3 or 2, one child per desk, whether it is a single desk or double desk, one child per desk. We are encouraging schools, as I said earlier, that all posters, all information on hygiene to be clearly visible throughout the school compound. And this is an effort to remind the students on the importance of things like hand washing, social distancing, and hand sanitizing. We are also emphasizing regular cleaning of the school environment, the daily cleaning of washrooms with soap and water, detergent and disinfectant, and daily cleaning of water troughs and the like. We expect that schools will be cleaned frequently, and frequently touched surfaces such as door handles, desks, toys, light switches, door frames, play equipment, teaching aids used by children, and covers of books should be sanitized. Although schools will be provided with alcohol, 70% and above, or sanitizers, hand sanitizers, we are encouraging parents to have students have their own little starch of hand sanitizer or alcohol, so they too can do their own sanitizing in their areas, their books, their bags, the desks, and the areas that they frequent. We are encouraging schools to sanitize washrooms before the school day starts, if possible during the school day, and at the end of the school day too as well. Especially where we have schools on shift, because we have schools, sharing schools, we expect that between shifts, the facilities will be cleaned and sanitized. Student desks, chairs, doorknobs, chalkboards should be sanitized before students arrive at school, and these can be sanitized during the day as well. So again, all these measures are aimed at preventing the spread, minimizing the risk of the spread of COVID. We also encouraging schools to ensure that classrooms are well ventilated, all the windows open so that there's enough ventilation in the classroom. We are encouraging parents too to go through these guidelines with the children, because they too have their own interpretation of things. It will be difficult at first for them, but we have to encourage them. In our guidelines, we have specific guidelines for the classroom, how students should behave in the classroom. We want to encourage them to wear masks. As I said already, teachers should laminate all their posters, especially if they're going to be touched by several persons. And we expect that children should, not only one student should be seated to a desk and a chair. So we have to help our students at home to follow these guidelines. As I said, hand sanitizers and spray bottles with rubbing alcohol should be given to the students so that they can have their own starch, although we expect that each class should have those. For snack time, we encourage social distancing in the playground, around the water trough, in the toilets, social distancing. Children have to be educated on how COVID is spread so that they can take precautions and take responsibility for themselves. We also want the schools to monitor the type of games that are allowed and the number of students that are allowed to play in the play area. Schools can determine that based on the individual school situation. We want to also encourage schools to teach our children the proper way to eat snacks to avoid contamination, especially where they may be using masks. We discourage the sharing of snacks unless between siblings. And we're also encouraging our students work with their snack for them to use during break time. And wherever they have water bottles or their juice bottles, these should not be exposed. So these are just a few of the guidelines for in the classroom, for snack time, and for individual students. We also have guidelines for sick students and teachers. Any student or teacher or parent displaying flu-like symptoms are asked to stay home. Any student who falls sick at school, we have identified a holding area for these students, and parents will be immediately called so that they can come to pick up the students. And we're encouraging parents to respond immediately when we call to have students be picked up. Same thing for teachers. A teacher who falls sick would have to inform the principal and leave the compound immediately. Again, the classroom of that teacher must be sanitized again, and all students will be required to sanitize their hands as necessary. Every sick person on the school compound will be dealt with carefully using protective gloves. I want to reiterate what are some of the individual protocols, what we expect staff and students to do. Hand sanitizing, frequent hand washing, in the case where hand sanitizing is not available. And in any case, after how many uses of hand sanitizer, students have to wash their hands. In some schools, some persons are timing the breaks and scheduling breaks to give students enough time to go out to wash their hands. And we also expect individuals to do the cleaning of surfaces, wipe their desks, wipe their bags, wipe their books as necessary. And we also expect individuals to follow respiratory hygienes. Cough, sneeze in the curved elbow, or use tissue. But those must be disposed of in the bins provided. The protocols that the Ministry of Education has developed has specific guidelines for early childhood, specific guidelines for students with disabilities, and the guidelines that we have prepared are not just for government schools. They are for all public schools, all private assisted schools, all private institutions, and all our colleges as well. We expect that especially in the early childhood facilities, there would be more frequent cleaning than for other institutions where you have bigger children. The Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence will provide continuous supervision, monitoring, and assessment of the implementation of these guidelines. Implementation of these guidelines will be ascertained through continuous site visits, inspection of premises, and we have invited the environmental health officers through the Ministry of Health, Wellness, and Health Investments, New Health Investment, to assist us in visiting school sites to ensure that these protocols are implemented properly. Thanks to the Ministry of Health, Wellness for their continuous support. Although thermometers will be provided to all our schools, the advice coming from the Ministry of Health, Wellness, and New Health Investment is that it is not necessary to do temperature checks every day. I want to use this opportunity to thank all our stakeholders, the general public for their support, the staff of the Ministry of Education as they assist in implementing these guidelines. We want to thank you tremendously for your fullest support, and we want to encourage all to adhere to the guidelines. The Ministry of Education will provide every support to all our schools so that we can help to mitigate the spread of COVID-19. As we have said already, if there is any drastic change in the COVID pandemic situation in Dominica, the Ministry of Education will change policy to suit. Thank you all, and we wish all a good year 2020-2021. Thank you.
Thank you to the Permanent Secretary in the Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence, Chandler Hyacinth. Being an educator is a special calling, and especially in this COVID-19 environment, it will take a lot from our teachers as well. For those parents who had to do the homeschooling, I'm sure you have a better appreciation of what the teachers are going through. So again, we want to thank our teachers for their dedication, and we wish them the best throughout this year. And of course, as we work to protect our students and the rest of the general public, and especially with our ports opened for visitors, the Dominica Air and Seaports Authority plays an integral role in our attempts at keeping COVID-19 at bay as much as possible. So we welcome this evening the CEO of DASPA, Binwa Badwell.
Let me say good evening to the Honorable Minister Irvin McIntyre, Ministry of Health, Wellness and New Health Investment, the National Epidemiologist, Dr. Hamid, the Permanent Secretary in the Ministry of Education, Human Resource Planning, Vocational Training and National Excellence, Ms. Chandler Hyacinth, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. White. We also have the officer in charge in the Office of Director of Primary Healthcare Services, Dr. Gilda Nesty Town. And we have the Acting Deputy Chief of Police, Superintendent Davidson Valerie. Let me say once again, welcome to all the viewers, and wish to take this opportunity to convey information to persons who wish to visit or return home to Dominica. To begin with, the board and management of DASPA's top priority is the safety of all persons utilizing the ports of entry, that is the airports and seaports, and assisting in the fight against the spread of this dreaded disease called COVID-19 by implementing health guidelines established in collaboration with the Ministry of Health. Since the recommencement of commercial passenger activity from July 15, 2020, a multi-layered approach for seamless health screening was embarked upon to minimize the risk of importation of COVID-19. From July 15, 2020 to September 8, 2020, we have handled 298 flights and some 1,317 passengers have arrived on the island, and some 1,305 passengers have departed utilizing the Douglas Charles and Keenfield Airport. Before booking a trip to Dominica, all residents, nationals, and visitors must familiarize themselves with the entry protocols into Dominica. Passengers who wish to travel to Dominica by air or sea should ensure that before booking or securing a flight or passage as a passenger on a vessel or an aircraft, that they should become familiar with the pre-arrival requirements. Passengers must go online and fill in the health questionnaire prior to purchasing or confirming an airline ticket or seat on a passenger vessel or aircraft before traveling to Dominica. The information can be obtained on the website http://domcovid19dominica.gov.tm. Passengers or travelers coming from the Caribbean bubble, that is Barbados, Antigua and Barbuda, St. Vincent and the Grenadines, St. Lucia, Grenada, St. Kitts and Nevis, Montserrat, Anguilla, and have been in that country or territory for at least 21 days prior to arrival must submit a health questionnaire online at least 24 hours prior to travel in Dominica. Passengers or travelers coming from low, medium, and high-risk countries are required to upload a negative PCR test result within 24 to 72 hours prior to arrival, in addition to completing the health screening questionnaire. Passengers will receive a submission receipt indicating that the questionnaire has been completed. Passengers will then be sent a notification of health clearance to travel by email based on the risk classification of the country they are originating from. A copy of the notification of health clearance to travel must be presented to the airline agent or ship agent before travel to Dominica can be finalized. This requirement is mandatory and must be complied with. Without a notification of health clearance to travel, the traveler or passenger will not be allowed to travel to Dominica by sea or air. This requirement must be adhered to avoid inconvenience at the airport or seaport of the country that you're coming from. Too many times we have persons who seem not to follow the procedures as outlined, and what they do, they buy a ticket, they end up being stranded either in Puerto Rico, St. Lucia, Barbados, St. Martin, and they're told by the airline representative that they need that health travel approval notice. They can't present it, and then that creates a problem. And so that's why we are encouraging persons and we're reminding them that they need to confirm their travel arrangements only after a receipt of a notification of health clearance to travel is received from the Ministry of Health. Because that is, in fact, one of the biggest problems that we're experiencing with people flying to those various transit points, not having the requirements for entry. General protocols and guidelines. Passengers are required to wear face masks or face covering at all times during the arrival process, up to and including departure from the airport. Passengers must observe physical distancing at all times, and they must practice good respiratory etiquette and personal sanitization. Passengers must follow all instructions of healthcare providers and other officials. In terms of the terminal, all persons seeking to access to the ports of entry will be subject to temperature screening. Passengers, travelers, or persons seeking access to the ports of entry who do not meet the temperature screening requirements will be referred to the health hotline personnel or secondary screening personnel where possible. Mask wearing at all the ports of entry will be strictly enforced. Face masks, face coverings will be required for all passengers, airport staff, airline staff, and all approved persons and other approved persons at all times. Failure to adhere to this notice may lead to delays at transit ports or disappointments, wherein passengers will not be able to board an aircraft or a vessel to travel to Dominica, irrespective of the country that they are originating from. So we trust that passengers or travelers will take note of the travel requirements to Dominica as we seek to protect our borders during this difficult period. So I trust that persons won't just pick up their bags and say, I'm coming to Dominica, without first checking the various protocols that we have and avoid any embarrassment that they may have at transit ports when they get there. Thank you.
And thank you so much to Mr. Badwill and the personnel of the Dominica Air and Seaports Authority for your continued efforts. This evening, we also have with us the officer in charge in the Office of the Director of Primary Healthcare Services. And the primary healthcare services are also an integral part of the fight against COVID-19, responsible for contact tracing, responsible also for the monitoring of those who may be at home following their travels. So Dr. Gilda Nesty Tong will be our next presenter.
Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investments, Mrs. Letitia Lestrade-Wyke, Permanent Secretary Acting in the Ministry of Health, Wellness and New Health Investments, Ms. Chandler Hyacinth, Permanent Secretary, Ministry of Education, Human Resource Planning, Vocational Training and National Excellence, Dr. Shaludin Ahmed, National Epidemiologist Acting, Mr. Benoit Badwell, CEO of the Dominica Air and Seaport Authority, Mr. Jefferson Valerie, Deputy Commissioner of Police Acting, and to all the listening public, good evening. COVID-19 is a public health emergency of international concern. As the outbreak continues to evolve, we must all consider options to prevent continued introduction of the disease to our country, and we must do whatever we can to reduce human-to-human transmission in places where the virus is currently circulating and in our country, Dominica. One of the public health measures used to achieve this goal involves what is known as quarantine. This entails the strict restriction of movement or the separation from the rest of the population of healthy persons who may have been exposed to the virus, with the objective of monitoring their symptoms and ensuring early detection of potential cases. Isolation, on the other hand, is the separation of ill or infected persons from others to prevent the spread of infection or contamination. When one is quarantined, it does not mean that the individual is sick or ill. It simply indicates that possibly that individual has been exposed to disease, and as a result, that individual must be secured away from the general public and monitored closely for the development of symptoms of the disease. Quarantine, when executed properly, prevents the individual, who is a possible source of infection, from spreading the infection. It also protects you and me, who are supposedly free of infection, from contracting the disease. There are several research articles that support the effective use of quarantine measures to help prevent the spread of disease, and in this case, the dreaded COVID-19. So while quarantine may be looked upon as an inconvenience to someone, it must be kept in mind that the benefits of quarantine far outweighs the inconvenience. This has been proven in the result of the management of very many of our several cases on island. Well, a few cases. The government quarantine facility in Portsmouth has been designated to do just that. And we ask everyone who have to be quarantined to understand the reason behind the measure. We recognize that one of the concerns of travelers is the wait time to be processed and transferred to the quarantine facility. I wish to extend our sincerest apologies for this inconvenience. However, please note that oftentimes the actual number of travelers arriving on island may exceed the expected number. This can occur, for instance, if travelers upload their online questionnaire or their PCR results at the last minute. These travelers are then granted the ability to board, thus resulting in the increased number of actual arriving passengers and ultimate delay in processing and transfer to the government quarantine facility. Now, following a period of quarantine, individuals are sent home, but with continued monitoring by healthcare providers. During that time, one will be asked to continue to adhere to the precautionary guidelines and protocols from the Ministry of Health, Wellness, and New Health Investments. I wish to reiterate the need to practice respiratory etiquette. Cough or sneeze into a tissue and toss that contaminated tissue into the trash. If a tissue is not available, a flexed elbow will suffice. maintain proper hand washing, use of 70% alcohol-based hand sanitizers. When washing of hands is not possible, hand sanitizers will suffice. Wearing of your mask in public places is also encouraged. The wearing of the mask should be done properly. Do not wear the mask beneath the chin, nor on the forehead. Do not hang the mask from one ear and proceed to have a conversation with your listener. Ensure that the mask adequately covers the nose and mouth at all times. It has been observed lately that we have let down our guards and social gatherings are being organized. Buses, especially during peak hours, are packed, oftentimes with patrons not wearing masks. At this time, we encourage everyone to protect yourself and others. Avoid large unnecessary gatherings, which can lead to the spread of COVID-19. Use a mask if such gatherings are unavoidable. Let us please adhere to whatever protocols, guidelines, and measures that will reduce or control the spread of COVID-19. Thank you for listening.
Our thanks again to Dr. Gilda Nesty Tong, the officer in charge in the Office of the Director of Primary Healthcare Services. And our final presenter for this evening is the Acting Deputy Chief of Police, Superintendent Davidson Valerie.
Minister of Health, Wellness, and New Health Investment, Honorable Dr. Irvin McIntyre. Permanent Secretary, Ministry of Health, Wellness, and New Health Investment, Mrs. Letitia Lestrade-Wyke. National Epidemiologist, Dr. Shaludin Hamid. Permanent Secretary, Ministry of Education, Human Resources, Planning, Vocational Training, and National Excellence, Chandler Hyacinth. CEO, Dominica Air and Seaport Authority, Mr. Benoit Badwell. Officer in charge in the Office of the Director of Primary Healthcare, Dr. Gilda Nesty Tong. Members of the media, members of the listening public, good afternoon, good evening, that is. It is indeed a privilege for me to once again address you on our ongoing efforts in the fight against COVID-19. I want to thank the many citizens who have provided invaluable information to the police. All reports received were processed. Stemming out of these investigations, 2 men were arrested and taken into quarantine during the last 24 hours. Other individuals whom the public had concerns about were checked and cleared. We are aware of the concerns of the public in relation to the individuals who were recently arrested. But we have been in pursuit of these 2 men for the past 48 hours. We have received reports that some people who have been placed in government quarantine at Portsmouth, pending the results, are conducting themselves in a disorderly manner. This behavior will not be tolerated and will be dealt with according to law. let me inform these individuals that the law makes it mandatory that anyone coming into Dominica shall, on arrival, be quarantined for a period of 14 days or a period specified in writing by the Chief Medical Officer. Therefore, any person who fails to comply with these requirements to be placed in isolation, surveillance, or self-quarantine commits an offense. Ladies and gentlemen, these requirements were specifically put in place to prevent any spread of COVID-19 in Dominica. Let me remind you that from March to June 2020, Dominica embarked on drastic and necessary measures to include total lockdown with a view to preventing the spread of COVID-19 in Dominica. Dominica cannot afford to return to a similar situation, and we must make every sacrifice to ensure that we don't return to that period. The Commonwealth of Dominica Police Force has instituted new measures and have appointed a selected team of officers who will deal with these reports. Also, we continue to partner with the Customs and Excise Department in monitoring our borders. Those officers have very strict instructions to deal with anyone found illegally entering or leaving the Commonwealth of Dominica. And they will use every legal means necessary to deal with the offenders. I urge all of us to adhere to the warnings and advice given by the relevant authorities and the police. The Commonwealth of Dominica Police Force pledges its commitment to enforce the law of the Commonwealth of Dominica and will do whatever is practicable to prevent illegal entries into Dominica and to bring the perpetrators to justice. Thank you.
And thank you very much to the Acting Deputy Chief of Police Superintendent Davidson Valerie. While these measures may seem strict, ladies and gentlemen, when we are faced with a danger, it is incumbent on those in authority to do what it takes to protect the general public. Again, like the Deputy Chief mentioned, it takes a collaborative effort. It is not solely the responsibility of the public sector to ensure the safety and protection of Dominicans, but every individual has that responsibility themselves to follow the protocols, to report what needs reporting to the relevant authorities. Of course, the hotline is always available for such reporting. You may call 448-2151, 448-2153, 448-2156. The digital number is 611-4325, or there's a toll-free number, 1-800-219. Again, the site for the health questionnaire, if you intend to come into Dominica, is domcovid19.dominica.gov.dm. Let me stress again, as Dr. Nesty Tong did, that everyone needs to adhere to the protocols and the public health and safety measures that we have been promoting, encouraging for the past few months. The hand washing, the wearing of masks, the respiratory etiquette, the sanitization, and the physical distancing. It appears that we seem to be picking and choosing where in public we should be wearing our masks, whereas you should do it all the time in public, on the buses especially. Please do that as you are in close proximity with other passengers. Let me thank all those of you who have tuned in. I'd like to thank our media partners for always coming on board to bring across this information. And we'd like to thank the Office of the Prime Minister for hosting us as always. And to our presenters, thank you for your time. Ladies and gentlemen, we wish you a good evening.